I have the honor and privilege to introduce Amy Schwartz, Director of IDEO, a cognitive psychologist, founder of IDEO, Chicago's Design Research Group, and senior thought leader in the company's health and wellness domain. Amy has over 25 years of professional experience in design, research, and innovation, 17 of them at IDEO. Amy has worked for a diverse set of clients, from small startups to industry leaders to government agencies. She's contributed her innovative research methodologies and human insights to award-winning projects that include design of surgical instruments, adherence strategies for the treatment of chronic illnesses, and even the design of a medical simulation center for a major medical school. Due to her passionate involvement in healthcare, Amy has a holistic understanding of the entire modern healthcare ecosystem. She already has a strong record of creating innovative design solutions, so what now is she tackling, you may ask? How to bring human-centered design thinking to big systemic health and wellness problems in the era of healthcare reform. And I'm sure we can all agree that this is an area where UX is extremely influential. Amy holds a PhD in cognitive psychology from Yale University and a BA in psychology from Columbia University. Please join me in welcoming Amy Schwartz.
Thank you. I should tell you before I even start that I actually am totally an Eeyore. So happiness is often a challenge, but it actually makes me a great designer and very empathic in a lot of situations. So what I want to talk about is happiness, and in particular how it in the health domain. And mostly what I'm going to talk about, I'll tell you some stories, and I'm going to give you some heuristics that I've learned along the way. So bad design can really make people feel badly about themselves. So I feel like we as designers have like an ethical responsibility to try and not make people feel bad, right? Like we want them to even get up to being joyous, but we certainly need to make sure that they don't feel bad. I actually had a personal experience last night that I want to share. I actually am very intimidated by technology, which is kind of funny since I work on like a lot of very, very technologically advanced things, and also because my husband is a computer science professor. But I had a designer at IDEO who helped me like with the final visual design of this presentation. And last night, she sent me a link to the Dropbox where she put it. And I had done the original thing in Keynote. And so I go to look at it, and I go to the Dropbox link, and I try and download it. And it says, you have to get a newer version of Keynote. And by the way, your operating system on your computer like needs to be upgraded. And I was like, I was not happy about that. But given that I know this about myself, I proactively said, hey, can you also send me a PDF via email of the presentation? And that's what we're using here. I still haven't been able to get into the Dropbox. But maybe there's some people here who can help with that. So bad design can actually make people feel badly about themselves. You know, it's not just about being frustrated, right, or being annoyed. Sometimes actually there's actually even like a dispositional attribution. I'm stupid, right? Like what's wrong with me? Why can't I do this? And the thing that's always amazing to me is even as, again, this is not all about me, but like even as a designer, I know that the design is bad, right? And I still end up feeling badly about it. So, and this is just, like a presentation, but when the design interaction that somebody has involves the health or the health of someone that they love, then we're actually especially vulnerable here. So what I want to talk about is how can we design healthy interactions? Interactions that motivate us when we're thinking about our health, when we're thinking about our physical health, our financial health, like how do we motivate rather than kind of tear people down when they're already kind of maybe not feeling so great to begin with? how do we design interactions that help us learn information that we might need to know about a medical condition we have, help us learn about ourselves, help us learn about, you know, our bodies and how our bodies react to things and what we can do to stay healthier based on our own personal patterns. Interactions that meet us where we are rather than where we should be. Nobody's perfect, and assuming that you know, somebody is ready to go to the ultimate degree to make a change all the time is just not true. So how do we kind of understand where somebody is and meet them there and then take them along? And then lastly, support us especially strong during vulnerable moments. Not just like usability moments, right? Like where there's poor usability, but actually moments where, like, you know, the cognitive load is off the map and we have tunnel vision because we're so emotionally overwrought. How do we support people during moments like that? I've been at IDEO actually for 18 years. That is one thing that I, even as an Eeyore, is something that makes me happy. I should correct the introduction, which was wonderful. I'm not the director of IDEO. I'm a director at IDEO. But I've worked on health experiences, you know, like things that are used by consumer, things that are used by doctors, you know, surgeons, things that are used by governments for decision making. I mean, just like an enormous range of things. And there's a couple of things, just 6 things that I've learned in all that time that I'm going to talk about today. So I'm going to give you 6 of the things that I've learned and give you some examples of how I learned them and also how we've applied them at IDEO, and hopefully you will agree. I'd love to have like an argument about some of this at the end. I really love a great argument. But also maybe some of this will be useful, I hope, to you. So the first heuristic is when we think about health and behavior change, we want to try and help people get into a virtuous cycle. It's not just about a moment in time. A lot of things are about, we want to get people into a virtuous loop where there's like repeat behaviors. I can't tell you the number of times that, you know, we work with everybody from startups to like very big companies to whoever. And I can't tell you the number of times that we have people that come to us and they say, I have the solution to, you know, whatever, is a reminder system. And, you know, a reminder might be something important if your problem, you know, is reminding. But if your problem is something else, then the reminder really is not going to take you very far. We see the same thing with, I'm going to gamify it, right? Like all of a sudden it's like applied to everything, right? Or not to, you know, you guys are way more sophisticated than this, the panel that was just here. Or I'm going to make an app about it. You know, we have pharmaceutical companies coming to us like just saying like, okay, we're going to make like a companion app to this new drug that we're launching. Well, what does somebody need an app for this? Right? It's not just about going directly to the solution. It's about analyzing the problem. So I want to share with you a framework that we use to analyze these kinds of problems. We call it the adherence loop. You know, by the way, I feel very strongly about the word adherence rather than the word compliance, because compliance is like something, the rules are there and you better follow them. And I feel like the word adherence is much more about a partnership. We've come up, you know, there's a plan and I'm, you know, adhering to the plan rather than I'm doing what you told me to do. I'm being compliant. So let's take a couple of examples and I can show you how we use this. How many people floss their teeth the way that they are supposed to? Really? Good for you. So this is one thing also that when our clients, especially some of our pharmaceutical clients, like, what's their problem? Don't they know they have this condition and they have to take their medication? Like, what's the big deal? And it's like, well, think about yourself. Like, how many of the things that we're supposed to do all the time do we do? So if you think about flossing your teeth, you know, first, if you want to sort of get into a virtuous loop or try and get somebody into a virtuous loop on it, you know, let's start here and believe. Like, you have to believe that flossing your teeth is like a good thing to do, right? And it kind of is going to make a difference like in your dental health and maybe actually in your overall health. So that's probably not a problem. I mean, right? Don't we all kind of believe that flossing your teeth is like a pretty good thing to do? So, okay. And then with this belief, there's a mental model that you have about how this kind of thing that you're supposed to do will make a difference. So you believe it'll make a difference. And you can kind of imagine, like you've seen on the thing, like there's plaque and you want to get the plaque off, right? And all of that. So you have probably a pretty accurate mental model of like what flossing actually does. So that's good. You know what to do. I mean, the hygienist shows you every time you go and you're like, yeah, okay. Right? Prompting, I don't know about you, but I've got my dental floss like out on the sink, right? Like it's there. I don't need to be reminded. I see it every time I brush my teeth, right? For me, personally, the big problem with flossing my teeth is the act, okay? It's sort of a pain. You have to put that stuff between your teeth. It gets on the mirror, and then it's like stuck on your fingers, right? And you have to like get it in the trash, right? Like that's, for me, the main thing about what's broken. When I do floss, I'm reinforced. My mouth feels good. It feels clean, right? So if I were going to tackle, flossing, I would think about all these pieces, and I'm going to show you an example of how we try and design for all these pieces, but I would really try and concentrate my effort here. Even with something like medication adherence, depending upon what the medication is, what the condition you're taking the medication for, right? There's different things that you would want to kind of beef up, or even different things that might be sort of weak for different people, right? So if you think about something like take osteoporosis medication, right? And let's say that, what happens with osteoporosis, unless you're in a situation where you like broke something, is you're a woman of a certain age. Everybody here is so young. But you're a woman of a certain age and they do this like DEXA scan on you in the office and they say, oh, your number is this, like you're at risk for like, and they give you some number, right? You feel fine. And they say, now you have to take this medication every day or else, you're going to be like, have brittle bones or whatever. And then, so I'm supposed to take this stuff every day based on some number, right? I feel fine. And I only know every 2 years, if I have like Medicare, say, it only pays every 2 years for another scan. So I've got to keep this behavior going for 2 years, and then 2 years later get a number, and if the number didn't change, it means that I'm doing well. Like that's pretty, like that's kind of hard to think about adhering to. We've used this framework for everything from, when you think about health too, like let's think broadly about health. There's physical health, there's financial health, right? There's like saving money. There's also, we've done a lot of work in the energy space with having people like conserve energy. There's also things related to that. So, another great example that I'm always like amazed by is like antibiotic, right? Like taking antibiotics and you're supposed to take, like the ones that you have to take for 10 days and everybody stops taking them after they feel better, right? And so again, let's remind people to take their antibiotics. The problem with antibiotics for a lot of people is here, right? Well, it's here and it's here, right? Because I feel better. And my mental model is a lot of medication when I feel better, especially for something that's acute, I'm done. I stop taking it. So how are you tackling that rather than like giving somebody a reminder? So let me tell you about a program that I think that we did a nice job of thinking through this whole loop on. This is actually a project that we did a few years ago. The client was an NGO called the Campaign to Prevent Teen and Unplanned Pregnancy. So they wanted to try and we wanted to try and help them design a system for choosing birth control and staying with birth control so that you would prevent unplanned pregnancies, which most people don't want to have. So this wasn't just a website. This is the homepage of the website, but this wasn't just a website. This was a whole behavior change and maintenance system. So just a couple of pieces that I think were interesting on this. If we go back to our adherence loop, one of the first things is like knowing how do I choose the birth control method that's right for me, right? And how do I kind of understand the dimensions that they differ on? And so we designed a method chooser page which shows all the different methods, and then, you know, in a sort of shopping, right? You're kind of shopping around for birth control. And then thinking about some of the variables that matter to people in the decision making, like yes, effectiveness matters, but something like how easy it is to hide if you're a teenager and you're living at home, you know, it might be something that's very important. So understanding what those user variables are, not just what, like, you know, the medical community says was important. And then from a prompting point of view, like, what's, you know, and it's thinking also about the right channel, right, for presenting information to people and reminding people and things like that. So, you know, using a you know, text message to, if you set it and this is what you want, to remind you to take your birth control pill or remind you to, like, take your ring out, is the right channel for that. So things were designed, like, for prompting here. And then one of my favorite parts of this system that I think they were so clever on is, you know, if you think about the act, like, when do people, like, okay, are we going to be in people's bedrooms or, you know, wherever they are where they're engaging in this risky behavior? Like, that's going to be a little bit difficult. But there are places like bars, right, where you're getting in a state that might, you know, kind of facilitate you getting into risky behavior. So we actually designed a bunch of things for the campaign that we put in bars. And so let me show you what these are. This is actually a mirror. So so imagine you're, you know, you're really drunk and whatever, and you're like kind of thinking about maybe like, wow, this would be really right, you know, and you go in there and you see your face in the mirror, and then this is like a poster under the mirror, and it shows you pregnant. And it says, "Are you ready for this?" It might make you stop and think a little bit, hopefully. Or this is one. This is in the bathroom for the men, and it says, "If you can hit this target, you can get a woman pregnant." And there's a condom dispenser like right about here. Or this one, again, this is for women. It's like, well, yeah, like his looks are 10, but his parenting skills are 2. So you might have a good time tonight, but like this would be the dad of your kid. So like think about it. So in a lot of the work we do, we use this, again, as a starting point for ideation, for thinking through the problem, and I think this is just a particularly nice example of it. Okay. Heuristic number 2, the perfect is the enemy of the good. Okay, people are not machines. People are human. People, you know, so the idea of expecting somebody to do everything perfectly is like, it's just not realistic. Like for the 1 out of a million people who do it, great. The pharmaceutical segmentation studies always call this person the treatment machine. You know, there's really not a lot of people like that. So we've worked with like a lot of very challenging chronic illnesses like diabetes. And so, you know, type 2 diabetes in particular, if you don't know about it, is a challenging disease. There's an epidemic of it. It like by and large is primarily, you know, a lifestyle disease. It has to do with like the food, you know, the food choices. It has to do with a sedentary lifestyle. And so, you know, when somebody is diagnosed with type 2 diabetes, they're often told, okay, you need to lose 30 pounds and you need to be testing your blood sugar this frequently and you need to like exercise every day. And it's like, whoa, 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 right? And maybe some people do some of that. So, but what we think about is, okay, how do we help people do, maybe start with like one thing or make one thing a little bit better? And so I personally, actually, over the time that I've been at IDEO, I've worked on a number of glucose meters, which you know, people use to measure their blood sugar, and they've come a long way, which is pretty awesome. But this is a meter that we designed a number of years ago for Bayer. And one of the things about blood sugar is any one individual blood sugar, unless it's like really, really high or really, really low, is like, that's not what you should really be paying attention to, like overall. You want to be like all data. You want to be looking at the patterns, right? You want to be seeing, you know, like trends and patterns and things like that. And so one of the things that's important also about blood sugar is that food influences blood sugar, and your target range of what your blood sugar should be is different before a meal and after a meal. And so we thought, well, and then people, well, now the meters do it, but people like are keeping records of their blood sugars. Now the meters are doing them. And so then you look at these numbers and you're just like, I don't know, like, how do I make sense of this? If you would have that one more piece of information, which is knowing whether that number was before or after a meal, it can make you a lot smarter about like understanding how food, influences things. So we said, can we figure out a way to just get people to, mark a reading about whether it was before or after a meal? And the meters that existed then actually had this functionality. The problem was, you'd have to go 3 steps down after you got your blood sugar number in order to like go do this. And the way that this task goes is once you get your number, you've accomplished your task. And so people were not using these meal markers. So we had this great interaction designer who was very new to healthcare. And one of the things that I really, like, I have a lot of experience in healthcare, and I'm almost like I need new eyes, on things. Like, this is another piece of evidence, another piece of advice. People that are like really experienced in a domain always have people with new eyes coming in also, because I find that when I'm with designers who've never worked in healthcare, they see things that I've just taken for granted, right, or that I don't see, and it's a very energizing and great combination. So what happens with blood sugar testing is, you prick your finger, you put the blood on the strip, and then there's time while this thing does the assay, and it's like down to, I don't know, 5 seconds, 3 seconds, whatever it is these days. And this interaction designer said, well, you have this time when you're waiting around anyway. What if we automatically brought up this prompt on the screen asking whether it was before, or after a meal? And then we got people, like, people might get in the habit of just automatically marking that because they have nothing to do during that time anyway. And by the way, it might actually bridge the waiting time for people. And we ended up calling it Autolog, and it was an amazing success. And I loved this feature so much that when I was doing like the usability testing on it, and people would say, I love this, I'm like, are you sure you love it? Are you sure it would never annoy you? And the answers that we got, it was like, you know what? I know I should do more. This makes it easy for me to do the right thing. Okay, the third one is use the power of analogy. I'm amazed at, we know a lot about how we understand all kinds of things in an analogous way. I work with some of the most creative people in the world at IDEO. They're just like amazing, and I'm amazed at how much analogy is used even in brainstorming for coming up with ideas. So we actually, use analogy very particularly, and even like design it into our research that we do analogous observations about something that might have some lessons. So one example I want to show is, I'm going to show you later some work that we did around, we've done a lot of work about shared decision making with patients and healthcare professionals, and very often I've sat in on lots and lots of like encounters between doctors and patients, and I can just tell you that very often it's like doctors are from Mars, right? Like people are from Venus. It's like, whoa, like they're just speaking completely differently. So when we were designing some tools about how to sort of talk to your doctor about colon cancer screening, actually was the topic, we were like, well, what are other sort of experts that you talk to that they kind of have a different language, but you have to find a common language. And we were like, well, what about like your hairstylist, right? Like, you don't know, like, I want a blunt cut with a number 32 scissors, like feathered, blah, blah, blah. Like, you don't go in and say that. What you want to go in and say is, you know what? I want to be able to wash my hair, jump out of the shower, throw some stuff in it, and run out the door. So you're the expert on kind of like your preferences and your lifestyle. And like the doctor can be the expert on the medical evidence, but you have to be able to find a common language. Also using analogy for familiar framing, medical things can be really overwhelming. There's a lot of really bad design in like, it's getting better, but like a lot of health communication is like horrible, right? And it's just like poorly done. It's like 30 years behind in things. And so when you think about, this is one of the pieces of the system that we designed around colon cancer screening. It's a website. It's still up. It's called Gut Check. It's on the National Cancer Institute website, main website. And again, when we were talking about colon cancer screening, by the way, colonoscopy is not the only effective option. Just nobody seems to know this, right? Like it's one option. There are other things that will prevent your death from colon cancer. So we actually tried to use sort of some familiar framing again, kind of like shopping-esque, right? Like here's stuff that works, here's stuff that doesn't work, and here's some stuff that's still being studied. And the doesn't work thing was kind of interesting because normally when you're doing a decision aid, it's just like, here's your choices, right? Actually, people make the choice of waiting for symptoms, and it's actually not a good choice, but we included that as being, kind of a valid thing that people might be considering. We'll talk more about this. I know you want. So the fourth one is when it comes to people's health and things where they're emotionally vulnerable, tone really matters. This is a lot more than usability. This is about the language that gets used. It's about how it makes people feel. So let me give you some examples of that. Long time ago, we were working on designing the first blood glucose meter, and not the first one, but the first one that we worked on in Chicago. And we sort of thought, how do we let people know? We should reinforce people, right? If their blood sugar is in a good range for them. And how could we do that? So one of the ideas that we came up with is we'll put a happy face, if the number's in range. And we showed this idea to the first person who was a 65-year-old man. And he was like, are you kidding me? This is insulting. I have a serious condition. I know what my blood sugar is supposed to be. And you're treating me like a child with a happy face. What are you going to do? Give me a sticker? And so, and it was really, I feel like I've learned, this is why research is so wonderful, right? You learn that you're just nowhere near as smart as you think you are. And it's just great, right? And so really, we evolved our thinking as we've designed, these kinds of products to be about treating somebody like an intelligent, making it easy for them, right? So it might show up, in a green number, just showing, hey, this number's in your green zone. But the idea of having sort of a happy face might be okay for a child, I don't know, but just really inappropriate there. Another one, I actually thought this was kind of nice. This is actually from a product that hasn't been launched yet. I think there was some piloting and pre-launch. It was at CES. It's called Mira, and it's a fitness tracker. There's so many fitness trackers. It's out of control, right? I mean, this is a fitness tracker actually designed for people who kind of walk, and not kind of the sort of middle-aged woman who, she's not going to Pilates and this is just you know what, just walk, and maybe even walk in a walking group, and just do a little something. So I just like the way that they did this prompt. So in this example, this is well, I think this was my goal, and I didn't do anything at all, right? I mean, I did go to the app to look at it, which is good. And so, this is not me. So this message said, listen, it's very non-judgmental. It says if plan A didn't work, you know what? The alphabet has 25 more letters. Keep trying. And then let me give you some inspiration. And then it gives you a little thing called a boost that you can try. This would be, right, completely inappropriate for the power athlete, right? So this is just about designing for your audience, but thinking about the subtleties. Okay. In health in particular, you have to often design to facilitate better conversations between people, right? It's not just about me and me looking at something. And we actually, I'm going to give you some examples of designing better conversations about my diabetes data and stuff like that. But we're getting into such fascinating we're starting to think about designing end-of-life conversations. I mean, we're, getting into just some absolutely fascinating, emotionally laden kinds of conversations and thinking about what they're like. But even if you take something like I'm going to give you an example around blood sugar, but then we can talk more broadly about data, right? I mean, data, right? Like, how do you help people have there's so much data, right? There's like, I can quantify everything about myself and track it, and there's just, you know, and there's unleashed data from cities and the government and everything else, right? And people don't want data, right? What do they want? They want insights that will then, you know, lead to decisions and action. But, you know, if you go back to like the diabetes example, you know, the people are supposed to be recording their blood sugar, and in a lot of places the meters, like in a lot of places of the world, like they don't have meters that actually even store the numbers anymore. And so people are, I mean, yet people are asked to, you know, so they're given these paper logs and they're asked to write things down, and most people are not doing this, or they do it the night before they go to the doctor. But the thing is, even if they do it, here's how the conversation goes with the doctor. They go into the doctor's office, you know, and the doctor says, looks for high and low numbers. What happened here? Highlight it. What happened here? Highlight it, right? This is like 3 months ago, and like I don't remember. Plus, you're making me feel like I was tested and I'm like failing. So it's really not a good conversation. Versus, this is what digital enables us to do that's like amazing, right? Like easily. It could be done here too. Having a summary to start out, where the first thing I see here is, you know, most of my blood sugars are kind of pretty, you know, they're in the green range. So the conversation can start with saying, you know what, most of your numbers are in the green range. Good. Now let's start looking at some of these. Now let's drill down and start looking at some of these highs and lows. It's a really different conversation. And we as designers can design to foster that. And so there's conversations with data. And then there, in medicine, there's so much, you know, thinking now about like, how do we have patient-centered conversations? How do we have preference and culturally sensitive conversations? And so if we go back to the colon cancer screening example, you know, very often the way that a physician in particular will think about things is they you know, they're very, like the way that they think about the information and the dimensions is they start with the medical dimensions. You know, the probability of this, you know, doing this is this, right? And they start out that level, and then maybe they get down to some of the sort of lifestyle implications of something, right? When we designed this, we designed it where we put both the sort of medical things, right, you know, there, but also like the things that a lot of patients care about, we put it at the same level in the information hierarchy. So for example, we heard stories from people where it was like, well, colonoscopy, I'd have to take a day off from work. I'm self-employed. That's like a big deal for me. Like, is there any other option? Or, you know, I don't have health insurance, which hopefully is changing. You know, this is the most expensive one. Do I really need to do this? And so helping the conversation by designing something that's used by both the doctor, you know, and the patient, sort of, we can help guide that conversation. And then the last one is, you know, how do we scaffold people during really key moments of uncertainty and stress? And I have two examples here. So this is, we designed one of the first defibrillators, which hopefully they have them around here. You know, they're everywhere. And so this is actually an amazing thing if you think about it. You're taking somebody who has no medical training, right, and you're trying to design an interaction where they're delivering like something that, you know, could be really dangerous if it's done wrong to somebody who's like in a, you know, is like could die. I mean, it gets pretty high stress. And when we did the original design, it actually, so by the way, it actually turns out that the two paddles, it doesn't really matter where the paddles go. They just have to be in different places because, right, you're putting current through the body. But when we designed the original prototype, we didn't have any kind of like direct image on it of where you were supposed to put it. And so people would like pick up these paddles and it was like, wait, where do I put it? It's like, and then they would say, no, it doesn't matter. Wait, it doesn't matter? It really doesn't matter? Like, what, right? And you'd lose all this time. And so by actually like directing them to do it in a certain way, even though it doesn't really matter, it saves like seconds off of the response time. And then the last example, we do a lot of work still with like designing hospital experiences. And there's just, you know, and by the way, like the design that we do now, it's like, and this is probably the same for a lot of you, there's there's digital interactions, you know, there's direct communication, there's spaces, right? Like it's, the solution is never just like a thing anymore. So this was a children's, well, this wasn't, but it's a children's, I was in a children's hospital a couple weeks ago, and I got in there, and the elevators, and think about the kind of state somebody's in when they're in children's hospital, like as a parent and as a child, right? Like probably very often you're not in a very, you know, happy state. And the elevator system was like, it was like what you have here. It's like, use this elevator bank for, and it wasn't even like consecutive. Use this elevator bank for floors 1 through 7. Use this for floor 8. Use this other one over here, you know, for this. And it's like, so here you are, you have people in a state of stress. You're making them like do math, right? And they're having to go to like pulmonology. What's pulmonology? I don't even know what that is. What floor was that on again? And so, you know, the designers of the space that we were in, it was like, the architect had paid a lot of attention to like bright colors and, right, like things that were, you know, like showy and not necessarily bad, but the thing that you really needed at that moment of vulnerability, which was having a really easy way to use that elevator, nobody had thought about that at all. So, you know, these are just some of the things I think that, you know, they're relevant particularly to health, which, you know, puts a specific lens on sort of some extreme things. I think they're relevant, and some of them have come up in some of the other conversations. But health is a domain where like human-centered design can like really make a difference. And, you know, Kathy mentioned like IDEO.org, which is like a great part, you know, of IDEO, but you know, that gets a lot of press because it's, you know, social impact and it's in, you know, underserved places. But the working on the healthcare and medical things has made, you know, an enormous difference also. You don't have to be working, you know, in Africa on HIV to make a difference that way. So just as a last, this is actually me, you can tell. This was a wonderfully empathic exercise that I got to do. I've done a lot of work in the surgical domain. We were designing some nerve monitoring leads for surgery, and we were testing out some prototypes, and I actually got to be the scrub tech to the surgeon. And part of what was amazing about it was, well, first of all, like, yeah, we talk about patients and us as consumers. Professionals should have great joy and great tools also, right? There's a real problem in medicine now with burnout. There's a real problem in medicine now where everybody's just like just EMRs are making, you know, like healthcare professionals, like it's just really painful. And so thinking about joy and having wonderful things to work with, right, for professionals also. But what was amazing for me was, like, having been in like hundreds of surgeries where I had to kind of stand, you know, back against the wall and not touch anything, I actually got to experience what it was like to be like a support person for a really, really demanding surgeon, where my job was to like make sure that the area was, I was suctioning the blood off and like making the tools all straight, and I was like really stressed out. So that was pretty awesome. So any kind of immersive exercise is great also.